I apologise to those people sitting out there that we can't see. We're all new to, possibly you all are as well, but it's quite challenging for on a digital platform for the very first time, with none of us having experience of it. So hopefully it will all go quite smoothly. I'm Jenny Popey. I'm the coordinator for public involvement and engagement across the School for Public Health Research. Today we're going to be talking about the evaluation that we are planning at this cross-school level, at the kind of strategic level across the school. And we've got a couple of great speakers who have experienced as public advisors, public partners in the school, and I'll introduce them in a moment. I just wanted to briefly give you a bit of context to this, really. So this is what we're going to do. I'm going to introduce it. Gillian and Vanessa will then talk about their experience of being involved in the public mental health programme, and I'll say a little about Gillian and Vanessa then. And then Margaret, Ogden and Michelle are going to talk a bit about the evaluation we're planning, but from Margaret's experience of being involved in evaluations before. So just to start with, let me give you a little bit of background. So Michelle, you moved, yeah, okay, next slide. Okay, so just so you kind of, most of you maybe, we don't know who's here, so we don't know how much people know about public involvement in the School for Public Health Research. So we thought it would be useful to just say that the partners, public partners, as we refer to them in the school, sometimes peer researchers, sometimes who are experts by experience, are involved in many different ways. So they're involved in the design, conduct and governance of research projects that's at a project level. They're involved in the governance of programs. We have 3 programs, which some of you will just have heard about in the plenary. And we also have 3 themes, which will be discussed at other points in the scientific meeting. And they're involved in the strategic management and governance of the school as a whole. So they are now, members of the public are now participating in our executive group. They're members of our advisory board, and they will be becoming involved in our governance of public involvement per se. So, so many different ways in which they're involved and many different levels at which they're involved. And in terms of evaluation, complexes, 8 academic members, as most of you will know, means that at the project level and at the member level, there's already some evaluation or assessment of the experience and impact of public involvement going on. And some of the programs, as you will hear from Gillian, are actually taking evaluation very seriously already. Some less so, some are monitoring public involvement, but not yet actually evaluating the experience and impact. So what we're interested in doing is looking at the experience of involvement and the impact that these experts or by experience are having by being involved in our work. We want to do that at a school level. And so this is what you're going to be hearing about, really, is some of the initial plans and ideas that we have and some of the work that we will be building on and to do that. So why do we want to evaluate public involvement in the school? Well, we think that it's an ethical imperative anyway that we should evaluate. We're taking people's time, we're taking their energy, we're taking their intellectual capital, and it's incumbent upon us, therefore, to ensure that what we're doing is doing no harm and is actually having an impact, doing good. But beside that, it's really important for us to capture the learning about public involvement in order for us to do it better, to do it better. And particularly as this 5 years of the school is coming to an end, there's a 3rd quinquennium, another 5 years will start in March. And we want to make sure that we capture the really good things we've done and we take those forward and we improve where we can improve in those next 5 years. We want to provide feedback to our public partners about the contribution they've made. We want to make sure that we recognise the value that they're adding to our work and that they know we appreciate that. And then we want to contribute to the wider evidence base about good practice in public involvement and the kinds of impacts that you can have if these partnerships between the public and academic researchers work really well. So we've got some principles underpinning this whole school evaluation. And the first is that we want public partners to be involved in designing the evaluation. We want some to be peer researchers with us doing the evaluation, and we want them involved in helping us interpret the results from the evaluation and in making sure that those interpretations are shaped into very practical recommendations for how we improve things. So that's the first principle, is involvement in the evaluation, authentic co-production. Then we want to build on the evaluation that's already going on, and Gillian will be giving you a really great example of what's already going on in the school. We want to build on that. We don't want to replicate that. We want to ensure the findings are useful and relevant to improve the approach in SPHR3, and we want to share the findings. We want to be open and transparent about what we find in the school, so that others can learn from it. So that's by way of an introduction. And now I'm going to actually hand over to Gillian, Samuel and Vanessa Pinfold. Just let me say a little about Gillian and Vanessa. So Gillian's been working as a peer researcher with the MacPin Foundation on the Public Mental Health Programme, which is one of our 3 programmes. She's been working for 2 years in the programme. And she's now the public involvement coordinator. She's taken that role on quite recently. In that role, she's ensuring that the voices of the public and lived experience are embedded across this complex programme, very large programme. So Gillian will be presenting now, and then she'll be joined by Vanessa. And Vanessa is the co-founder of this very innovative organisation, the MacPin Foundation. And between them, Gillian and Vanessa will answer questions. There's a Q&A function. I'm not going to try and tell you where to find it. You're probably all more digitally literate than I am. So if you put your questions in there, I'll moderate them. So Gillian, when you're ready, I think Michelle's going to manage the slides for you.
Okay, thank you so much for introducing me to the session, Jenny, and for inviting me to speak here today about our experience of evaluating PPI in the Public Mental Health Programme. I won't say any more about myself because it's already been said, but I thought it would be good, before I sort of leapt into the evaluation side of our work, to summarise our journey which led us to conduct the evaluation. So we started work in May 2019 with Laura, our coordinator. There were 55 applications for peer researcher roles, and Laura spoke to 25 people and selected 5 to form a peer research team. It was such a lengthy and detailed recruitment process that Laura wrote a blog about it, which makes for very interesting reading. She quotes, "I am proud to say that as much as this limited the number of people we could involve, we do hold a great richness of diverse identities, experiences, ages and locations within the 5 of us." Thank you. Can you, next slide, please. So how did we work together as a team? We allocated peer researchers to support different pieces of work across the programme, in fact, across all 5 work packages. This required lots of relationship building and upskilling to understand jargon, methods, and who was who. Remember that the public mental health programme spans 8 universities with a whole cohort of academics, so there was a lot of people to meet. We developed our own work too. we created a website called I Am Public Mental Health, which included a response to the COVID life pandemic, where we asked the public and invited them to contribute to their feelings around what the impact was in a pandemic on their mental health and the mental health of their communities. And we also decided to evaluate ourselves as a way to learn and develop. Next slide, please. So our evaluation strategy, why we began evaluating ourselves, I'm going to talk about that, and I'm going to talk about our approach. Could you go back, please? So our approach to evaluation and a few learnings. Next slide, please. So why did we feel we should evaluate? Well, when we started our work, we soon realised there was no template and little guidance about what to do and how to do PPI in public mental health research. So we needed to build one. Now, does the public mean anyone? What expertise, what might we bring into the programme? We felt we had a lot to learn from each other, both as peer researchers and with the group of academics, and we wanted to document our journey. We decided early on it was vital to document our journey. We needed to learn how to improve public involvement in public mental health, and hoped our experience might be useful evidence for impact in what we did proved useful. Next slide, please. So our approach, we kept something called reflected logs, which was to document key moments as we went through the stages of being involved in the programme. We asked ourselves, were we being treated as equals? Were our voices really heard? Why was it so difficult at times to think of what to say, certainly in large meetings? Did what we say actually have an impact? Was our opinion applied in any way to make positive change? And these were all questions we were asking ourselves along our journey, along our route, because truthfully, it was very, very challenging to answer some of those questions and to feel comfortable in our involvement. We had continuous dialogue and feedback to the programme manager, feeding learning in as we went, and receiving feedback in return was very helpful, very important in the evaluation process. We took it upon ourselves to write a PPI report at the end of phase 1, where we built on all our reflective entries and shared this with the co-leads and the senior team. We had a meeting to consider the findings with the co-leads. We designed and led on a programme-wide survey to explore experiences of PPI, understanding the experience, the impact, and this was among everyone involved at 8 partner universities. And there was a final summary report at the co-leads meeting. So what worked well? Well, the process helped our team form and bond, because this was, remember, this was like a continuous evaluation process right from the beginning, which grew organically. And it gave us a real strong foundation for our team to be together, to hold conversations and to tell each other as it was happening. So we held something called Pianist Days, which enabled us to do that. And we were open, curious and aware. The co-leads and coordinator were very open to our suggestions and to our feelings. And this was very important to us because, for example, when we're sitting in a meeting, which is, you know, we're a small team of 5 peer researchers trying to have an impact in a room filled with 80 plus academics, sometimes that can feel overwhelming and daunting and sometimes even uncomfortable. But in our evaluation process, when we had dialogue with our colleagues, they were very much able to take our feelings on and make suggestions on how to improve. So there were individual relationships with some work packages which enabled direct feedback and co-learning and co-productive work sort of rose up through there. But the survey response, unfortunately, was very low, which was indicative of perhaps low importance in some areas of PPI or a reluctance to state views. Next slide, please. So the question is, what happens next in our evaluation process? Well, now we're in phase 2. We are definitely going to keep going, not just with the work, but we're building on all the learnings from last year. We will evaluate during phase 2. We have new staff, new responsibilities, and we're actually going to be leading on a specific work package also. We are setting up a buddy system which will encourage reciprocal learning. Next slide, please. And if we were to look at recommendations for wider evaluation, we would like to capture views across the entire school at different levels of seniority and across institutions, programmes. We'd like to raise expectation of this early and build engagement and a buy-in. We'd like to offer choices, be flexible in methods used. Perhaps we must most definitely recommend the reflective diary approach, and to survey the entire school at 3 points to capture thinking and experiences in the hope that we would see change over time. And also to run focus groups or interviews with PPI contributors and some mixed groups with collaborators, stroke leads. So thank you very much. If you have any questions, do put them in the chat. My email is on the screen. And the website to I Am Public Mental Health is also there, which makes very interesting viewing, certainly within our COVID Live project. There's some very interesting entries from the public, artwork, text, very revealing and beautifully presented. So I'm now going to be joined by Vanessa Pinfold, and so together we'll be answering any questions that you have. Thank you.
So thanks very much indeed, Gillian. That was really interesting. I've heard one other presentation, and this has just set me off thinking again about how fascinating and valuable it is what you're doing. There's no questions at the moment. Please do put your questions into the Q&A box. In the meantime, Vanessa, do you want to tell us a little bit about MacPin while we were waiting for questions?
Yeah, I mean, I think a number of people on the may have heard of us. We're a small charity. We're a mental health specialist charity. We were set up by my partner and myself a few years ago, and we're really passionate about expertise from experience and improving the quality of research by ensuring that the perspectives of people with lived experience of mental health problems, however they describe that, are really a core part of research. I think that in this field, it was really challenging when we were set the task of building a peer research team. And we actually went to Public Health England first off and said, how do you build panels of people? When you're trying to engage the public in kind of research work, what's your approach? Because I think we were very aware that it's very difficult to kind of reach all aspects of public in a very few posts.
Yes.
And I can see, I think Andy's written a question in the chat about representation.
That's right. He's actually asking whether in the work you've been doing in the public mental health, you've been able to assess inequalities in representation, the gender, ethnicity. So that point is really, you were expanding a little on that problem, weren't you?
I mean, I think in the PPI team, when we were looking at recruiting people, if we think of just how we were recruiting our workforce, we were very clear that we wanted people to bring different life experiences into the project. We didn't ask people to have a sort of diagnosis of mental illness. We're much more interested in what the narrative around public mental health was and in a sense, inequality. We were interested in working with people with experience of homelessness. of discrimination because of intersectionality, whether that's because they're part of the LGBTQ plus community, whether they're an ethnic minority community. So we were looking at people, we were interested in geography, we tried to recruit people from across the country. So in terms of our team, we were very aware that we wanted to bring people with a mix of experiences. In terms of actual research that's happened in the programme, obviously inequalities is one of the key threads throughout this. And what I would say, and Gillian could maybe say a little bit more, is I think one of the things that this team has done is it's kind of been quite vocal of the fact that we want to do more. So all the other work packages have been set in phase 1 and we join them. Whereas in phase 2, we have created our own work package and it's about inequalities. And we're going to be doing a photo voice study. We're going to be exploring public perceptions of unfairness and inequalities. And in that way, we will definitely be monitoring the people that come forward to work with us. So we're going to be doing 40 in-depth interviews. We're going to be collecting photos from those 40 people of how they what unfairness and inequality means to them. And we'll be keeping an eye on the diversity of the sample. It won't be representative, but we are going to be looking at diversity of experiences in that piece of work.
Okay, that's great. Thanks. I see some people seem to be commenting in the chat. There's some in Q&A. The participants here are testing my digital skills, but at the moment there's no other questions there. I have one really. On the reflexive logs, it's a very interesting, some people call them impact logs, reflexive logs. I just wondered, Gillian, you mentioned the benefits and the richness of them, but I just wondered if you could reflect a little. I know Margaret's some experience, so she might come in her presentation, but on some of the limits or the challenges of using the reflexive logs.
Well, I think, first of all, doing the reflective logs was very challenging, but in a way it was our only way of helping us to understand and make sense of what was actually going on and what we were meant to be doing, what we were doing and what we were meant to be doing, and what it meant for us as people with lived experience coming in from the public and contributing to this programme. And reflection enabled us to do that. And it wasn't just through writing, we did that through art and creativity as well. And it's really about having our own narrative, putting it in our own words, in our own way, our feelings about how it was to contribute on this programme. In some senses, that has expanded into our COVID Live project on I Am Public Mental Health, because when the pandemic struck, we knew that it would have an impact on people's mental health. We know that, and the communities in which they lived. And so we encourage that kind of reflections through offering the opportunity on COVID Live to the public to reflect on that. And amazing response. It's really been incredible, the amount of people who were creative during lockdown and were able to put into words the impact on mental health. So in summary, reflective work is very, very important and very revealing.
Yeah, absolutely. No, I agree. And it's interesting the different ways the different modes of reflection that some of you have used. I think that's a really important point. So I can't see any more questions.
Jenny,
yes.
I was just gonna say one thing that is really important, I think, to say is that you have to have a team that are, as in the wider school. We were lucky in the School of Public Health that we have managed to get a balance. It's how you use your reflective work, because you've got to then feedback, and then you have to hear what other people feed back to you. So I think what's been really interesting for our teamwork is that we found it helpful as a team. We then had to work out how to curate our messages back into the centre, and they had to help find the words of feedback to us as well. And this balance, because obviously everybody's trying to work productively, everyone's trying to work towards, good quality research, and we're working with very different cultures. Academia is a very different culture to what we're talking about doing reflective work in a voluntary sector organisation. So I think that's the other thing that I would say, is that we found it really helpful, but we've also had to learn really carefully about how to use that reflective work productively, carefully, to then work with our colleagues to kind of feedback some of the things that have worked well and not so well, and then vice versa. So it's a balance between those things.
And just to add on to that, it really, I think, having that base, the base of having done the reflective logs gave our minds clarity, so that we were able to voice our opinions and engage in that dialogue with academics in a more productive way.
I think it's a really useful model in terms of the new Public Partners Network, the PAN that we've set up, which is cross-school. So as Gillian was there this morning, every member of the public involved in our work is automatically a member of that network, and we've started to have network meetings, and that network's going to set up a subgroup around evaluation. So I think that will help us create that reflexive space with the public involvements across the school. That will be important. So I'm going to move on to Margaret. Margaret Ogden, who's a very experienced public advisor to many different types of research projects. But she has a special interest. In fact, she said earlier, she has a passion for evaluating public involvement in research. And she's been involved in at least 2 different types of evaluations. So Margaret's going to talk a bit about her personal experience. And then, as with Gillian and Vanessa, reflect on what that might mean for our cross-school evaluation. So Margaret, take it away.
Thank you so much for the opportunity to speak to you today on this. My passion and my specialism in PPI, one that I'm really enjoying working in. The first question is why? Why do PPI evaluation? And I came across this quote in a paper: if we are serious about involvement, we need to be equally serious about evaluation of impact. Over the past 10 years, international literature evaluating PPI has more than tripled, and I think that gives some credence to the reasons for carrying out PPI evaluation. My experience has been keeping an impact log, which is really useful, and that idea of reflection, I think it's very important for PPI members to see that, and also for researchers to be able to use it. There are various ways of feeding back how impact has been made. And undertaking a full PPI evaluation, which is a much bigger project and perhaps more applicable to evaluating the PPI in a school or in an institute, where you're looking at the whole picture. And I put at the bottom or both, which is probably my preference if it's at all possible, although obviously there is a resource issue around that. So firstly, this was Project CLAD, Community Engagement in Alcohol, which I did with a lady called Joanna Reynolds. And it was an evaluation, but it wasn't anything that had a huge focus on impact. We would have liked to have done that, but we would have needed ethics approval to go back to PPI members and ask them to perhaps fill in a survey in the initial stages. But Jo did take on board the idea of evaluation, and she decided to look at the PPI experience. And her idea was to have a focus group and invite professionals such as managers and PPI coordinators. It wasn't really a PPI event as such, in that PPI members weren't there, although I did go there to help facilitate and take notes. And we got a lot of rich data. It was collated and analysed using thematic analysis, and findings were subsequently published in a paper. PPI members had been interviewed in locations in which they preferred, and a second interview took place to obtain depth of perspective. So really the evaluation was twofold. It was the focus group of professionals and managers and coordinators, and it was also interviewing PPI members, and they were quite in depth. So measuring impact, I think that is about, it can be about PPI members completing feedback forms after meeting, and researchers keeping an impact log, although I have to say on one occasion I have been asked to kind of keep control of that impact log, which feels quite a responsibility. But with the feedback forms, I think it's a great mechanism, but you are relying on PPI members completing them. And it's a little bit like asking PPI members to do something slightly professional, and not everybody's going to buy into that, I feel. You know, there is a project where we haven't got enough data to give a complete picture, and that's been quite disappointing. So as Jenny said earlier about the challenges of measuring impact and carrying out an evaluation, that's one of them, just not having enough data to give you that picture. And PPI members failing to complete the feedback forms, it's an extra thing to do at the end of a meeting. And perhaps not everybody enjoys filling them in. You know, it was something that I had to do immediately while it was all still fresh in the mind. Leave it a few days, and then, you know, you've got to really think back to what input you've had at the meeting. So yes, my preference would be a combination of both. The need to have specific details of impact, yet the need to see the overall picture. And I think that would be suitable for looking at PPI evaluation in the school. Be aware of the intangible benefits of PPI. We talk about this a lot in PPI circles, where you feel that you've had an impact, but you're not exactly sure what it is. And I always refer to the domino effect, a contribution that a PPI member gives during a meeting, but it may not be taken up immediately. It may be even several meetings, or even at times several projects down the line that can be taken on board. And the challenges of evaluating PPI in public health compared with illness-specific research. And I think they might be quite different. I gave an example this morning of where perhaps a patient with cancer would give input about invasive diagnostic tests. And, you know, that would be very specific to feed in. But in public health, a lot of the work I've done has been on evidence synthesis. And that's quite an abstract term. A researcher's asked me today to do some work on that, and I will do it, but I'm just aware of the challenges around it. It is so abstract and quite hard for PPI members to pick up and to, you know, to give in-depth input into their contributions. So I think in response to what Jenny asked about challenges, there would be the things that I would say about it, and also about burden. Take into account that PPI members may, you know, be continuing quite intense activities, and yet PPI evaluation would be another dimension for them to get involved in. But it can be light touch. or it can be more intense. And thematic analysis is something I'd encourage PPI members to get involved in, but it does need quite a bit of support to do that. You can assist with the coding data and developing a coding framework. So need to consider training needs. The data is fully anonymised. And the time that it takes, plan well ahead and allow sufficient time. And when reporting research findings of an evaluation, consider offering co-authorship to PPI members if that's possible. Find a home for your report. For example, the research involvement and engagement publication, which I believe was set up initially by PPI members. And perhaps a conference. There aren't very many completely appropriate, but there was one in 2018, and that was on international perspectives on evaluation of patient and public involvement in research, and it was held in Newcastle. Though I haven't seen any details of plans to hold another one. COVID might have come into that in the decisions, I think. The process can be lengthy. One evaluation took a year to be published, and there was a change of staff in that time, and there was a change of the PPI in that time. So continuity can be broken a little bit, and you've got to keep the momentum going. But I've got to say, for me, it's been a wonderful experience, and I would certainly encourage other organisations to do it.
Thanks very much, Margaret. Really raising lots of really important issues, both some reinforcing what Gillian was saying, some new. There's a lot of comments actually that I'm seeing, one or two questions, but a lot of comments about the need to adequately fund public involvement, both public involvement in research, but in the evaluation of public involvement as well. And the challenge of doing that in small organisations. SPHR is a large, complex organisation, but we have reasonable funding, so we can fund public involvement. We may want to consider doing more of that, but for small organisations, it can clearly be quite problematic. I just wanted to ask Margaret, Gillian, Vanessa, focusing on the questions. There's lots of comments, but focusing on the questions. One question, Margaret, you raised it, and Gillian, I think, in a way, that we've got a lot of evidence that public involvement can be a really positive experience for people, but also that it can go wrong, And so I'm just wondering about the extent to which evaluations should explicitly be looking for the negative impacts as well as the positive impacts, and whether there are any particular challenges in doing that and making sure that evaluation picks up the disbenefits. Gillian, do you want to have a stab at that? Or
I'll have a stab at it. As a person with lived experience in PPI can be very sensitive, but it can be very rewarding. It's actually both, and you don't know each time you get involved which way it's gonna go, and it can kind of be both at once, all at the same time. And I think when you're considering evaluation and that process, and you're speaking to people who are doing PPI and they've had some challenges, you have to have some kind of support mechanism for people in case they get distressed, in case they get upset. It's good to have things in place that will take them through that process safely, especially if you're doing evaluation online and not in the real person. And funny enough, in our new work package that we are running ourselves, we are looking at just this kind of issue, so that when we go out into the community and we intend to interview 40 people about inequalities, for example, that's a very sensitive subject. And so we are considering what things we need to have in place to support people.
Okay.
but don't disencourage it, because you need to hear things from people as it really is for them. And that's the beauty of talking with people in a qualitative way, because you're getting their raw experience.
Yeah. Okay, thanks, Gillian. Margaret, do you want to?
Yes, thank you for that. And it was interesting what Gillian said. I've done 4 evaluations now, and the negative side that's quite often come out is communication. Keeping momentum going through a project, you know, and sort of researchers are very good communicating at meetings. But what happens after a meeting? You may wait a long time to get the minutes. There may be months between meetings, and just how do you keep that level of communication going? Because really that is the threat to PPI, that if you don't keep a reasonable level of communication, the PPI is kind of perhaps a little bit likely to drop off and your numbers start decreasing. So raising that issue of communication, when I was part of a PPI evaluation team, just how do you raise that with the researchers? Because it is negative. It's all very good feeding back to them the positives, but feeding back something negative when perhaps there have been a little bit at fault of letting communication go, that's got to be done quite sensitively. And possibly at a high level. It wasn't something I would have personally liked to have fed back to the researchers, but the professor who was taking on the evaluation, she was quite happy to feed that back. So I think it was important to say it. It was important to find it out, and it was important to say it as well.
Thank you, Margaret. That picks up on Vanessa's point earlier about it's not just collecting the data, it's actually having a good process in place for a dialogue about what you do about the findings. Yeah. There's another issue here, which I think both of you again have brought up, which I just wanted some reflections on, which is, I mean, one of Andy, I think it is, who's saying, no, it's not Andy, anyway. I'm trying to find the question. Let me forget about naming names. Basically, you both said that, I think, Gillian, you said the survey was not very well responded to. And Margaret, you said sometimes the pro formas didn't come back, you know. So, and I think one of the questions is saying that though they value public involvement, they know it's important, the pressure of the research project means that it's sometimes marginalized because they're busy collecting the data for the research, analyzing the data for the research in the time frame. So, and that could be interpreted as not valuing public involvement. So I'm just wondering if you're going to do an evaluation of public involvement, whether your experience means surveys are not a good way to do it, or whether there is a way of doing that kind of larger scale data collection that will that means you can get better responses to it. Because it's my experience as well is that you don't get good responses to some of these surveys around public involvement. So you might address this issue of response, not getting the data.
Am I going first here?
Yeah, go.
Yeah, okay. Well, in this situation, it was a small team of PPI members, a small group. But I did think in retrospect, it would have been good to have a buddying up, because there was some of us who were very experienced and, you know, sort of given feedback as to the level of input you'd given at a meeting kind of came naturally. But for newcomers, I think sort of assessing for themselves how they had contributed, you know, into the meetings, that was quite a challenge and quite a big ask. And yet if they'd buddied up, the more experienced people with the others to give them support and give them ideas of the questions they could ask themselves. I think that would have been a way of getting more data from them.
Right.
As it happened, it didn't happen, and we've had to abandon that particular exercise. So if I was doing it again, I would certainly think about buddying up, but without the buddies having to sort of control it, you know, that you would want the newcomers to have their opportunity to put their input, and for that to be confidential as well. The buddies wouldn't have to see it. I mean, the confidentiality around this kind of data is exactly the same as any project. So you've got to keep that confidentiality, and anything has got to be anonymized as well.
Gillian, did you want to?
Yeah. Well, for us, it wasn't like one day towards the end of phase one, we decided to evaluate the PPI involvement. It wasn't like that at all. It was much more informal, and the idea of evaluation grew organically, as I've said before, throughout the process of our involvement. And so really it was like, rather, imagine you're not sitting an exam, you've got that course that you're doing, which is continuous assessment. That's kind of what we were doing in our evaluation. It was continually assessing our involvement and what was happening, what was our impact throughout the whole process, certainly at key events when we were involved with that. And that all came together at the end of phase one in a substantial report where we looked at all of our reflections, all of the narratives that we'd had with the academics over the course of phase one, and brought it all together with a set of recommendations. That worked for us. You know, the survey was just a tiny part of it, perhaps wasn't so well built in, but there was much more to it than that.
More to it,
yeah.
So Michelle, I'm going to hand over to you to just do the last few. Is that are you there? Are you with me?
That's okay. Yes, I am. Sorry. Okay, so I'm just going to spend a couple of minutes just sort of talking to you about some of our initial thoughts about this. Jenny sort of talked at the beginning about the purpose of the evaluation and SPHR and the principles underpinning it. So I just wanted to just share a bit of the thinking that we've had around this so far. So in terms of what the evaluation might look like, we think there'll be two elements to it. One focused on the public partner experiences of being involved in the school, and that will be at different levels, work package, programme, whole school level. But also we're sort of keen that the evaluation should focus on the impact of public involvement on researchers, research processes, research outputs, knowledge exchange, etc. So that's what we're thinking in terms of the structure and the shape of the evaluation. We do recognise that given how SPHR is, it's sort of geographically spread out. It's quite a complex organisation, 8 academic centres. There are some potential challenges that we need to think about in terms of undertaking the evaluation. And one of those challenges is capturing the variety of experiences that public partners might have within the school. Work packages, programmes have their own cultures, practices, processes, systems around public involvement. So it's going to be a challenge to sort of capture that, I think. And finding out about the evaluative activity that's happening at package and programme level so that we can build on rather than replicate what's already happening. But actually finding out about that is another challenge that we need to sort of build into our planning. And also understanding how many public partners are involved in the school's research and work across the board. So it would be great to capture that. In terms of what we've done already, an evaluation working group has been convened, and I think this will grow and it will evolve, and we'll get new members in according to the needs as the group does grow. We review progress reports from work packages and programmes to sort of pick up on any evaluative activity that we can sort of go back to the work packages and programmes to ask about. We're also working with the members of the school's public involvement and engagement strategy group and operational group. So they're two groups focused on public involvement within the school that involve members from each centre, each academic centre. So that's a very helpful forum for discussing this. And also public partners. We started a very initial conversation this morning with public partners in the Public Partners Network meeting, but that discussion will grow and develop. And we're also planning, we have public partners on the evaluation working group, and we'll also have the subgroup of evaluation subgroup for the PAN. Okay, so I think we've just maybe got a bit of time for questions, Jenny.
Have we? A couple of minutes. We're supposed to finish about 55, aren't we? Yes. So
okay.
There's a lot of comments rather than questions about evaluation, but there is one I see here coming up from Stephanie, that Margaret and Vanessa have been involved in a bit of an exchange around power dynamics. I wonder if Vanessa, well, Margaret, you've commented on it, not just in relation to the researchers, but among the public members as well. And
I mean, we've all come across the kind of autocratic boss, and it has happened in PPI. I mean, I've been fired 3 times, but it's made me fight all the more. You know, I'm a bit of an activist for PPI now, and I campaign as well as actually doing PPI. So yes, it does happen, but I do think building up very strong relationships makes that less likely to happen. And the same among PPI members. I always say, if there's 2 co-applicants, that's the one relationship I work the hardest with. Because if that relationship becomes too competitive, it can be a nightmare. So I put all my energy, I have good relationships with research teams, but the one person that I put a lot of energy into is the relationship with the fellow PPI member. I like equality of opportunity. I push for that. And I think, again, that helps power dynamics. It's no good if one PPI member is getting all the plum opportunities. We do need to branch out and encourage people, to perhaps get involved in different areas of PPI. There are a lot of different activities, and everybody has their own strengths. Some are good at writing summaries, some are good with social media, and all those things contribute to it. So yeah, that's my view about power dynamics.
I think we've just about run out of time. So Margaret's had her last word. Gillian, is there anything you want to add to say?
No, just to expand a little bit on what Margaret was saying, that I mean, our team, when we first started on our journey in the public mental health programme, there were definitely some issues with power dynamics. Certainly when we attended the larger meetings, when we were invited, for example, to introduce ourselves, we had only time given to give our name and the fact that we were a peer researcher, nothing else. So we were at risk of being seen as the people with lived experience, the face of mental illness, and nothing more. And we felt that there was something about the power dynamics within that was keeping us in that place, or people were perceiving us like that because they didn't see us as anything else, all unwittingly. So over time, we through evaluation, we have vastly improved on that. And not only are we given space on every agenda to speak about our work, but when we are invited to introduce ourselves, we are encouraged to not just say our name, the fact that we're a peer researcher, but all the other skills and experience that we bring to this work. which includes our studies, it includes our work experience, our volunteering, anything really.
Yeah. Yeah.
So, and that dissipated the power dynamic.
And I think that it's been really, really helpful, certainly from me sharing and listening to the two of you and Vanessa's contribution as well, in terms of taking forward the cross-school evaluation, because I think that many of the comments in the chat I haven't done justice to. They're really, really helpful. Issues around in the school linking the public partners to PhD students and to our postdocs, so that that we have, you know, richer networks in the school to share experiences as well. So I hope the Public Partners Network will help us to do that. I hope the evaluation will get at some of these issues around power dynamics, about the proper costing of public involvement, about embedded public partners versus other models, because we have a great diversity of approaches to public involvement in the school, so we can look at the benefits, particular benefits of strengths of some versus others. So it's been enormously helpful for me. I hope you wider participants out there who we can't see or hear have enjoyed listening to it, have found it useful, and so thanks very much for that. There's one more message. We're going into refreshment now. Michelle put it on a slide in case stress of managing this platform made me forget, but please do take the opportunity of this break if you can work out the platform, which you're probably all much better at it than I am. There are video presentations by the pre and postdocs with fellows and the FES projects. You can actually interact with fellows and FES project researchers during the session at 4 o'clock and ask them questions about their work. So please use all these magical parts of this platform. I'm about to go off and do that. And thanks very much, Margaret and Gillian, for your contribution. Michelle, you too, and Vanessa for joining us as well. So thank you. I hope you enjoy the rest of the meeting.